Yes.
Fantastic.
Yes.
All right. Well, as mentioned, thank you so much for having me today. I am John Zandi. I'm one of the epileptologists at University Hospitals in Cleveland. Very honored and again humbled to not only be able to speak today, but also to work with patients and families here in Northeast Ohio. In any case, we'll have a little fun today. This is not a topic that I confess I know much about. And it's not a topic that is written on much in the medical literature, but to my surprise, there is actually a growing body to chime in and ask. With that said, let's get going. So essentially today, we're going to review seizures and epilepsy as a condition, as well as some statistics around it. Obviously, something most people may be familiar with, but just to go over some things. We'll also define social media, also things that people are probably pretty familiar with, and as well as explore its place in society. And then we'll look at the use of various different social media platforms for the epilepsy community. So with that said, we'll start with epilepsy. So epilepsy has been around since the dawn of time. Since there was life within us, that life has been experiencing epileptic seizures. The Greeks were one of the first to name it with the name epileptin. And my apologies to any Greeks out there that I just slaughtered that word, but it essentially means to seize or to take hold of. That's what the word actually means. And it does refer to the attack and not necessarily the condition itself. It's also been described as a condition of getting taken over, seized, attacked, or possessed. And again, that's where the word seizure comes from. As if a demon had entered the body of the sufferer. And one of my favorite quotes from Arateus, which was an old philosopher in ancient times, that it can be an illness of various shapes and horrible, which is something that those who suffer from seizures know it can be very horrible. And that's why we all endeavor to try and wipe it away. So what is a seizure itself? John Hewlings Jackson, back in the 1880s, helped us with our modern day definition, but it's essentially paroxysmal or kind of happening every now and then, recurrent, usually brief, stereotyped phenomenon that may or may not feature loss of consciousness, may or may not feature some stereotyped activity. People can have complex sensory experiences or maybe not. But certainly with all of these various different elements of it, it's not necessarily, speaking of social media, what we've been told that it is by how it's been depicted in various different forms of media in the past. So not entirely accurate what's out there. And it's important that we make that distinction because it is something that's very prominent, very ubiquitous. The definition of epilepsy itself used to be considered someone having at least 2 unprovoked seizures greater than 24 hours apart. So if you have a seizure Monday morning and then you have a seizure Monday afternoon, you wouldn't be considered to have epilepsy. However, if you had your first time seizure Monday morning and your second seizure Tuesday afternoon, then you would consider to be to have the condition of epilepsy. But in the 90s, we added a couple more definitions, having 1 unprovoked seizure plus the probability of further seizures. So some kind of finding on either imaging or electrographic EEG studies that gave us a 60% chance of having a seizure sometime over the next 10 years. Those patients would also then be considered to have the diagnosis of epilepsy. And then the International League Against Epilepsy also added the definition of an epileptic syndrome. So something like juvenile myoclonic epilepsy, where patients might have big grand mal generalized tonic-clonic seizures, absence seizures, or petit mal seizures where they kind of stare off, myoclonic seizures where they jerk. That would be one example of a particular epileptic syndrome. So some facts about epilepsy, as I mentioned, it's out there and it's fairly prominent worldwide. It affects everyone, all ethnic groups, rich and young, rich and poor, young and old. Doesn't discriminate. 65 million people around the world actively have epilepsy. That's about 4 in 1,000, even up to 10 in 1,000 at any given time. Here in the US, about 3.4 million people have some form of epilepsy, and that's out of, well, that number has risen a little bit, about 330 million people. That's 3 million adults, almost 500,000 children, and boils down to essentially 1 in 26 people in the United States will develop epilepsy at some point in their lifetime. So even if 1 in 26 people don't necessarily have it now in this moment of time, if you get together in a room with 26 people, at least one of them will develop epilepsy. It's a very common condition. Here in the state of Ohio, about 126,000 patients have active epilepsy. About 17,000 of those are children. And 65,000 people here in Northeast Ohio have epilepsy. And Ohio actually is ranked number 7 for the amount of people who have epilepsy in the United States among the states, at least as far as the 2019 numbers tell us. So as far as some of the things that can come with epilepsy, in addition to the seizures, we know that epilepsy can be a rough condition for other reasons too. The anti-seizure medications that we take and our patients take, they have side effects, and oftentimes those side effects can be really disturbing and life-altering. And so we as physicians try and make sure that we reduce those side effects as best as we can. Headaches also go very commonly with seizures, as well as depression, not only from having seizures themselves, but also from a lot of the anti-epileptic medications as well. We also know that epilepsy can do a lot to impair life goals. Sometimes it can cut education short. It can affect our ability to drive, if not permanently, at least for long expanses of time. And that can really have an effect on developing and maintaining social relationships, can to some degree, at least per the literature, affect employment trajectory, although fortunately the Americans with Disabilities Act in both its 1970s and 2010s iterations has done a lot to try and prevent that and make sure employees are working with patients with epilepsy to try and reduce that. And then, of course, contributions to morbidity and early mortality. Unfortunately, injury from seizures is a very real thing. Anyone who's had a seizure, particularly a big seizure, can likely tell you there's a high risk of getting injured. And then there's the very, very real, very scary, very rare condition of SUDEP, or sudden unexpected death in epilepsy, that can take life, and particularly if seizures are not well controlled. So that's a little overview of epilepsy. Now we'll kind of get on to a different topic of social media. You might think, John, how are these two interrelated or combined at all? And I would have said, I don't know. But it turns out there's a lot of interrelationship between them, and that's the whole thing we're going to talk about today. So as far as social media, it's been around for some time, probably over at least 2 decades now in various different forms. I think MySpace might have been the first ones on the scene, but there are a lot of other places out now to have that online forum. What social media is by definition is a broad online platform where people can communicate with each other. It's kind of a modern day town square, a gathering place to share information. Way back when, in like the 1600s, for instance, you might go to the center of town and talk to friends and read the printed newspaper and just kind of go around and see what other people's lives are like. And unfortunately, a lot of that's done online these days and done in the form of social media. Turns out a lot of the world is online. There are about 3.8 billion out of the 8 billion or so amount of us here as residents on the planet Earth. So just under half of people are actively using social media in some way, shape, or form. As a result of that, you can imagine there are a lot of pros and cons to things. I know there's been a lot in the news lately about some stuff, so we'll start with that. We'll start with the bad stuff because it's good to get that out of the way and acknowledge it is a very real thing. Social media is not a perfect platform, and it can have a lot of effects that can be kind of rough. In fact, just in the last month or so, Congress has held hearings and brought in some of the leaders of these social media platforms, Zuckerberg, Musk, um, all kinds of people related to social media, to look at the effects that it has on people, particularly children and adolescents. Mental health can be tremendously affected by social media. I'll be one of the first people to say I got off social media for that reason. It's tough being on social media all the time and just being overwhelmed with all these things. And I found life a little more peaceful without it, but it can be a great tool. So I think there are a lot of things to be worked out yet with social media and how we regulate things. But some of the downsides that they found, people can get offended pretty easily, whether it's or not it's intentional. It can really injure relationships and reputations. People can meet and see different cultural and social standards, and that can cause friction sometimes. And then there's the fact that people can post just about anything on any topic at any time with really no kind of regulation to that. So as a result of that, it's hard to know what's a reputable source and what's fakery, what's kind of just made up and being passed off as real. That can also have a negative impact on doctor-patient relationship. Patients may think that doctors are saying something that online disagreed with, and doctors can see stuff online that may go against what they've learned in school. And is it new and cutting edge research, or is it just completely fake stuff that's being made up? And that can cause some issues. It can make that essentially difficult to establish trust with people. Again, any kind of rules and regulations, if there were them, or if they did exist, trying to enforce those rules can be really difficult. And conveying a message, even if you do have a message that you want to convey, that you want to get across, that's from the heart, it's very real. The way that you choose to do that, the content behind that, can be easily misinterpreted, and so you risk information, and from that, conspiracy theories. Not to mention stigmas that can come out of it, violence, religious and cultural classes, and then there is all of that kind of building and turning into mental health concerns. Fear of missing out, or FOMO, a definition that I think this word was created in the last 5 years, largely due to what people see on social media and see everyone else living their best life, and Mr. Jones is on vacation again, or Sally went to Cancun. Why aren't I going to Cancun? It can make us have that little bit of inkling of jealousy. That's a natural feeling, and we may fear that we're missing out on what the rest of the world is doing, not realizing that maybe those pictures are the once in a lifetime event that happened, and it's hard to know. People don't tend to put all the bad stuff online. They kind of use the filter, and they take the best picture of the 36 that they took and use that one. So there's a lot of it builds a lot of anxiety about keeping up with others and having life look the same. Not to mention cyberbullying, sleep disruption, stress, depression, all of these things, the false prestige that people can build up about themselves. And then you think, oh, I really trust that guy. He seems to really know what he's talking about. And that guy might, I have no idea what he's talking about. It just, I don't know, comes up with stuff that looks good. So, why use social media? There's all this bad stuff that can happen with it. Like, just seems awful. Well, like everything really out there, it's not all bad. There are some good things to it. It can have a potential to reach very large audiences. I mentioned, hundreds of years ago, going to the town square, if you had something to say, you really were just kind of confined to people who lived in that town with you. It's to spread information from, let's say, Public Square in Cleveland to maybe Perth, Australia. It's a long journey. It's a harrowing experience, months and months and months of time to get there. And now you can share something with Australia from Public Square. If you sit down on one of the benches, tap on your phone, and instantly that message is there. You can have direct and personal messages. It doesn't all have to be something that you're just explaining to the masses. You can text someone or have these I guess the cool kids are calling it DMs or sliding into D. I don't know what that means, but anyway, you have that kind of personal touch to it that is available. High user involvement and retention. Generally, if you have a social media account, you're doing something with it. So you can kind of tune in one day and then check in, 2 weeks later and see, hey, what's happened? And you may not miss any messages because everything is there and stored, and you can review stuff. So it's a good way to follow things over time. Users can take an active role. A lot of times, it was, well, I have to be involved in radio to send a message to a lot of different people, or I got to get on the news somehow to share my story. And now you can just open an account and create some content, share things. A lot of times it is a supportive environment. It's not always a negative environment. It's a good way to reach family. I've got family in all over the United States, and we're able to talk over the phone, and in my old accounts that I had, we were able to share stuff. In addition to that, you can talk about emotions and healthier behaviors. I think there's been an online movement to really make mental health something that's out there, and kind of get rid of the stigma behind it, and educate on these different medical conditions that are out there. It can also have an effect on disease outbreak surveillance. I don't need to tell anyone in this audience, we just went through a global pandemic. And one of the ways that we kind of looked at how things were going were social media reports on how people are doing all over the world. And that led to a lot of health research and the ability to detect disease outbreaks, and when things were getting worse and when they were getting better, and even find participants to participate in research. It used to be you had to kind of wait till a patient came into your office and make a diagnosis and ask them, hey, do you want to be involved in this research study? And now systems can put out a tweet and say, hey, do we want to, if anyone has this condition and is interested in participating in a study, just reach out and contact us. So it's been a really great way for hospitals and major news organizations to disseminate news. And as a result of that, it's had an impact on our politicians. Politicians are always looking for that vote. And so they want to get behind what the people are saying. And one good way to see that is, what are they saying on social media? Probably the best thing, at least medication or medically, is the way that we've kind of developed something called peer-to-peer healthcare. Patients can share awareness about their condition, not only with their doctors and their communities, but with other patients. And that really helps people to know and feel a little bit more comfortable. Okay, what I'm experiencing is, to some degree, it's natural. That's what these other patients have experienced. So what I'm going through, maybe the side effect from this medication or the way I feel after a seizure, maybe that is what other people are experiencing. Maybe it's a little bit more normal. And I don't have to feel so alone in feeling that way. So there are some good things to social media. And taking that kind of peer-to-peer experience, what does that really look like? It's turned into some tools for treatment to some degree. Those shared experiences allow patients and the medical community itself to build and maintain these social connections, whether it's a local connection or a connection with people all over the world. And that can really reduce feelings of isolation by opening up these abilities to communicate, especially with patients with epilepsy. A lot of them, if they can't drive, maybe a very isolating feeling to not be able to get out and kind of do things together. And if you have an online community with other patients who are experiencing that, you can have chat rooms and group texts and Facebook groups and things like that, where you can share your what you're experiencing, even if it's just, this is what I did today, this is what I did today, and have this sense of community, even if you can't physically get to wherever these other people are. And that can be used in a positive way. It can be used for good, to encourage each other. And it can also be a nice forum to vent about what's going on. Gosh, my dumb doctor changed my medications again, and now I had another seizure, and I don't know what's going on. And it's a good way to blow off steam with people who have been there and experienced what you have. So, social media, can we use it for good? And it turns out we can. And actually, there's been a lot of research into doing just that. And this is actually something I'm pretty excited about. I had no idea this was going on. But in the realm of medication adherence, when patients come in to office, one of the questions that the doctor is going to annoy you with, you can almost be certain, have you missed any doses of your medication? How many days have you missed, or how many doses have you missed? Once a month, once a year, once a day, once a week. It's very easy to forget a medication. I myself forget to take my medications sometimes. Turns out, on average, patients forget at least one dose of medication at least once a month. And that can, if things get out of control quickly, it can lead to hospital time. If you have a breakthrough seizure and things are really, really rough, you land in a hospital, and that translates to higher costs and all kinds of things. Not to mention the worst part of a breakthrough seizure, and that's sudden unexpected death in epilepsy. And anti-epileptic medication is the only known preventative tool that we have to reduce that risk of SUDEP. So medication adherence is very, very important. It's a very tough thing to do, but very important. And so what are some strategies that we can use to improve that adherence to help us not forget to take our medications? Can we simplify the medication regimens that we're on? Can we change beliefs like, yes, you might be experiencing this side effect now, but hold out a little longer, your body will adjust to it, you'll start to feel better. We can use it to teach more about the medications that we're giving. And I think doctors can do a lot better job than we're doing now at a lot of these things. But social media can help us. And in the turns out in the diabetes world, some very interesting things are happening to that regard, and that's the concept of gamification. So what gamification is, it's the use of video games to motivate users to engage in activity with this ever-increasing intensity and duration. And kind of use these game elements in what would otherwise be a non-gaming setting to make it fun and make it competitive. You know, I'm not a very competitive guy myself, but if I'm playing a game on my phone, I start to lose, I start to get a little ticked off. And so I think there's some kind of inherent competitiveness that all of us have to some degree, particularly with a game that we're playing, and a lot of times that's on our phone. And making it increasingly difficult over time tends to make us want to rise to that challenge and do that. I'm trying to learn a language on Duolingo right now. And for anyone using Duolingo, if that bear gets mad at you, you kind of get mad at him back, and it makes you want to do better, and show him who's boss. And so there is that kind of inherent drive that we have. And so in harnessing that technology through push notifications or alarms or mobile apps, it turns out there's a lot of science behind that. In fact, there's something called the Wheel of Sucre, which is this conceptual framework for how to make a game or how to kind of develop it. And like I said, one of the areas that is being used now is in diabetes self-management, which is kind of interesting. But any good game, it turns out, needs to have at least 8 elements. Fun, that should be at the top of the list, because why play something if it's not fun? It should help your self-esteem and not cut it down. It should help you grow as a person. I don't know that I necessarily grew playing Candy Crush when I did, but it does exercise your pattern abilities in your brain, and those brain cells and those neurons that say, okay, match this pattern and match this color, and there is some healthy thing to it that helps you grow, and it does kind of help you stay motivated. It's sustainable. It kind of keeps you wanting to come back. It does help you socialize. I know I would share my Candy Crush level with people and then get immediately embarrassed that I was only on level like 68 and other people were on 479. But it's a fun way to socialize and kind of also give us something to do and represent how we are as people and to some degree manage our time. I set aside time for Duolingo each day and try and motivate myself to do that, because it is both fun and it's something that teaches me something. So anyway, turns out they are using that in the field of diabetes. There's an app that helps children. This particular app is geared towards children, to enter the food that they eat, and that will translate into the various different breakdowns, this many carbs, this many grams of fat, this many grams of protein, kind of puts that information together in a fun way where you have this kind of monster leading you along and saying, okay, log your food, and it gives you points and stuff like that as you do it. And the monster encourages you. And then that data gets sent to the parent. The child's parent also has that app and gets that data that the child enters in a format that helps them understand, okay, I know little Sally is eating, and her blood sugars are likely going to be doing this, and so I can prepare, if we do need to adjust the amount of insulin she gets this day. It can really help with that. The child likes it because it's something fun and it's exciting, and it's game, and it's helpful for the parents. It's helpful for the physicians to know, okay, this is how the child's diet has been going. This is how they've been eating, and so this is how we can prepare and change ideas for medication. So at least that I found in the medical literature that's out there, and this project is in a legitimate medical journal. All the stuff in the talk today is from legitimate medical journals. Talk about online sources and things like that, reputable sources all. And so to my knowledge, there's no anti-seizure medication thing like that, but maybe there's something in the works, or maybe someone in this audience who's good at coding can make a seizure med sal, a salamander, particularly happens to be the one for Monsters Inc., who helps you regulate your anti-seizure medication use. And maybe you can do that through a game. Log your medications Monday morning, great, 50 points. Log them Monday afternoon, great, 50 points. Maybe you did it for a week, you get a 1,000-point bonus. Whoops. And maybe you forget one day, oh, we're gonna knock you 200 points, and so your February score total will come up to be like 2,650 points. Let's see if you can get to 3,000 in March. Something like that. I'll be honest with you, I kind of got excited just putting the concept together. It made me want to to log my own medications and try and get that 1-week bonus, even though, again, it's all completely arbitrary. None of it exists. But it speaks to that little bit of fun that we can have. So social media can be a great platform for something like that. One of the ways that is in use already is through educational videos. So if you don't happen to be familiar with YouTube, YouTube is an online website, has about 122 million daily active users, 2 billion people, so about a quarter of the entire planet, have used it and use it on a regular basis. It's a good way to share experiences and share information. And it turns out epilepsy is something that people share about. There was a research study that was done on epilepsy videos on YouTube, and they looked at 60 videos about epilepsy, and they compiled all of the data from those videos. Turns out those 60 videos were viewed almost 13 million times. They received about 130,000 likes, about 4,600 dislikes, and generated almost 8,000 comments across those videos. How did the videos break down? Well, about 46% of them were some kind of educational thing, teaching about epilepsy, teaching about anti-seizure medications, some kind of educational work. About a third of them came from hospital channels. This hospital putting out information about this, or that hospital putting out information about that. About 12% of them were doctors generating these videos, kind of sharing information, teaching about things. 7% were healthcare organizations, and this kind of surprised me. About 5% came from news agencies. And so what does that look like? This is actually just one YouTube channel with various different subcategories of things. This is the National Epilepsy Foundation's YouTube channel, and that has all kinds of different subtopics, everything from outreach to specific patient communities, to ways to get involved in fundraising, walking to end epilepsy, having that deeper conversation about sudden unexpected death in epilepsy, or SUDEP, from doctors, from patients' families who have sadly experienced it. The way that we look at epilepsy and COVID-19 has a whole video sub-channel about these things. So it really is a great educational forum. And again, that's just one epilepsy foundation that's out there. In fact, I have a colleague in Detroit, Dr. Omar Danoon, friend of mine, who makes epilepsy videos to teach. And this is, again, he's a physician, he's an epileptologist, he sees patients, and he has all kinds of videos about, epilepsy and different kinds of epilepsy and what to do during a seizure and what kind of medications you take and the side effects of those medications. And again, this is a great forum for physicians to kind of spread the word about things outside of an office visit, which can often be stressful and often be rushed and all of those things. And it can help patients, generate questions. I heard this. Is this real? And is this something I should expect or experience? And education is power, no matter where it comes from. And even, and again, Dr. Danoon is an expert as an epileptologist, but even if the videos aren't from an expert, at least it kind of puts a question in your head, like, is this something I should expect? And that's something then you can talk to your doctor about. So a lot of cool things for that can be done with social media out there. So again, looking at those 60 videos, about 3/4 of them shared information about treatment options for epilepsy. Like I mentioned, Dr. Danoon has a whole sub-channel in his channel about the various different anti-seizure medications. 72% explained different causes for epilepsy and how they come from and where seizures come from. Over 50% of them covered, what to experience or what are some of the symptoms of having a seizure. This kind of made me a little sad, but this study is also a little old. The study's from 2019, and I think a lot has happened since 2019. But only 3% mentioned, the various different options for support groups. And as I mentioned, I think a lot has happened since then. And on that topic, the neat thing about, these support groups, particularly the ones online, is there can be all kinds of different support groups that are out there. These are just a couple pulled from Facebook. But they're national and international. You can be an epilepsy support group from someone from England if you want, and you can share that experience and how it differs in your country versus their country, and what they experience. Or if you can get around the language barrier, talk with someone in China or Australia or Italy or South Africa. Just all kinds of different options for the world. Because epilepsy is a worldwide condition, to share with each other and build this community of reaching out. And I think Northeast Ohio is a particularly great place to be. Oops, sorry. I'll get to that in a second. But even support groups from around the world can address some of the rarest subtypes of epilepsy. There was a study done about FIRES, or fever-induced refractory status epilepticus. Is an extremely rare subtype of epilepsy, and it's a subtype of another rare condition called NORS, or new onset refractory status epilepticus. It generally develops in children. They get a fever, and about 2 weeks later, they go into refractory status epilepticus. It can be really, really dangerous. Up to 12% of patients can pass away from it. It's a really terrible and terrifying thing. And if it's this rare condition, it might be tough to find anyone, at least locally, who's gone through this and experienced this. But it turns out, and again, the study was done, there's a Facebook group that was established in 2012 to connect families who have experienced this super, super, super rare condition. It is a private group. It's protected by some parents who are admins for the group. But essentially, it talks about all these different themes of everything ranging from support, be that spiritual support or human support, social media support, being able to talk about your experience, see what happened. It brings experts together, people who work and have seen this rare disease and have studied it. Find those experts, make families feel empowered. and kind of even talk about medical advice. And again, you always have to be a little careful about medical advice you get online. But if it's being driven by families who have experienced it or physicians who have treated it, um, there's a little bit more weight behind that, and that can really kind of help families feel empowered. So, okay, what about this? Why don't we try this? I saw this worked for this group in Malaysia. What can we institute something like that? Um, and so, the different views on coping and all of the discussion around it unleashed or revealed this desire to have more research about this very, very rare condition advertised. So this is one of the really great ways that we can harness the power of social media um, to bring awareness and bring community to even the most even the rarest of conditions. And as I started to say, we are extremely lucky at the local level. Not only do we have a very robust patient and family and community acknowledgement of epilepsy, but we've got just fantastic local organizations. We know epilepsy can be so socially isolating, and that having a group of shared experiencing and a sense of community can be really great. It's an opportunity to make friends who understand what we're all experiencing, what patients have been through, what families have been through, and find allies. And we're so fortunate here. I happen to be speaking today for the Northeast Ohio Epilepsy Association, which is just a tremendous organization that we're fortunate enough to have here in Northeast Ohio, that puts on awareness and does fundraising things. And again, I'm participating in something like that right now, online to a community. And another great group we have in town, Empowering Epilepsy. I mean, these are ways that we can use social media, even to get offline and bring people together in person and do things and experience things. Really is fantastic what we have going on here in Northeast Ohio. And I gotta say, they don't have this everywhere. So I think we're really fortunate here. And I have noticed, and I'm sure the Northeast Ohio Epilepsy Association and Empowering Epilepsy have noticed that not all of their members are from the Cleveland area. Some of them are from farther away because being online unlocks the ability to do that. So I think we're really, really fortunate. Now we'll shift gears a little bit into kind of one of the more fun areas of, I think at least, of social media, and that's memes. So what memes are, if you're not already familiar, is at least they were first described in a 1989 book called The Selfish Gene by Richard Dawkins, a self-replicating unit with potential significance in explaining human behavior and cultural evolution. And essentially what that translates into is using familiar characters from movies and TV to convey some kind of thought. And they're oftentimes a lot more genuine than actual photographs, actual pictures. Because I mentioned at the beginning of the talk, people usually use filters, and let's say you took 20 pictures, you choose the one best one that everybody's eyes are open and everybody's smiling, and it just makes it look like everyone's having the best time. Memes are a little bit more real, and sometimes they can be a little sarcastic, and sometimes they're meant to make you laugh. They're meant to make you say, oh, I'm thinking about this. And it turns out there are a lot of memes in the epilepsy world. There was another paper that was done a couple years back looking at various different epilepsy memes and the way that they convey the condition of epilepsy and how it's perceived, and how patients feel and how families feel and things like that. So this one on the left, this picture of an iceberg. On the surface, you hear about someone having epilepsy and you think, okay, they have epilepsy. They have to take medications. Sometimes their seizures can injure them. Sometimes they may be disabled from their condition. They should avoid flashing lights. And, it kind of boils it down and simplifies it. But what people don't see are all the other things, the hours and hours and hours of doctor's appointments, the tests that you have to go through, the side effects of the medication, the exhaustion that you might feel after a seizure, the isolation, the bullying that may unfortunately exist, the financial hardships created, the stigma of epilepsy, the anxiety that you might feel about having a seizure, the basically just all of these other things that patients can look at and say, yeah, I feel seen. That's what I'm experiencing too. And I'm frustrated that people only see that tip of the iceberg sometimes. Making new friends, sharing the diagnosis of epilepsy, meeting someone for the first time, and epilepsy being a disease that you can't necessarily see when you talk with someone, unless you're actively having a seizure. Someone you meet may not appreciate everything that you're going through, how many seizures you've had, and what you've been through, and what you know. And that can be frustrating too. And then that waiting for a seizure, that knowing, okay, I've got to take my medication. If I don't take it, there's a possibility I could have a seizure. That kind of overanalyzing and getting worried, and oh, it's always there, or maybe, okay, today I didn't have a seizure, maybe I shouldn't have been so worried. But it's easy to say that. It's easy to boil it down and make it that simple, but it's a very real frustration that you can have. And then when you're having trouble paying attention, or talking to someone, and maybe you miss what they said, or did you have an absence seizure, or maybe that was just you started daydreaming a little bit. If somebody was talking, I'm sure I'm causing a lot of people right now to wander off with my rambling speech. So it's kind of a frustration that you can feel, and again, to know that somebody else is feeling that, to be seen in the way that you feel, can be really nice. Going to a doctor's visit and having the doctor explain all this stuff to you, and understand, and then you walk out the door and, oh my gosh, what did we just talk about? I do the same thing when I go to my doctor. She talks to me about, okay, we're gonna do this, we're gonna do that. I say, great. I walk out the door and I'm like, what are we talking about? And so, that's a very real thing. There are a lot of memes on anti-seizure medication. This one's kind of cute. It's three dragons. One's really, really mean and angry, which is a side effect that Keppra can make. One's kind of dopey looking, and Topamax at high doses can make us feel a little foggy. Lamictal, I think the side eye there is from the way that Lamictal can, at high doses, affect and cause blurry vision, double vision, and just kind of a way to depict some of the experiences. This one I got a real kick out of, and this is just kind of something that a lot of doctors will use these big, silly medical words when it's not necessary. The word idiopathic. Doctors may say, well, your epilepsy is idiopathic, and all that means is we don't know what's causing it. So why don't we just say we don't know what's causing it, instead of using this big, fancy word, idiopathic? So it's kind of a fun way to poke fun at doctors doing the same thing, because it's something that's out there, and it can be really frustrating. And if we're the only ones, or if we think we're the only ones feeling that frustration, it's hard to feel like somebody sees me, somebody knows what I'm going through, when a lot of people feel that way. So memes are kind of a fun way to do that. And then this one was also fun. So we have an epilepsy monitoring unit, as do a lot of the other hospitals here in Northeast Ohio. And patients always, when they come to my office, they say, it was really awkward being in the epilepsy monitoring unit and having to call the nurse every time I wanted to go to the bathroom, or know that there was somebody watching me if I itched my face. Was that a seizure, or where was I just itching my face? So it kind of helps bring out that community too. It's not the most comfortable experience being in the epilepsy monitoring unit, and we know that as clinicians. But things like this help remind us, patients, this is not the most fun for our patients to be going through. Help us be more sensitive when asking them to go through a big test like this. Now, of course, to get off memes for a little bit, there is a lot of bad stuff, as I said at the beginning of this talk, that can happen. There's misinformation out there. Fake news and fleecing things are very real. There was a family in England. This mother essentially made her child fake seizures in order to get donations from TikTok, which is really pretty nasty if you think about it. Luckily, that kind of came out, and there was some prosecution that occurred from that. But a lot of other things, cyberbullying can happen too online. And there was another story also out of England. This is cyber flashing. So photosensitive epilepsy or seeing a strobe light and having a seizure is a very rare subtype of epilepsy, but it's out there. And this young patient was online trying to raise awareness and raise money for epilepsy, trying to use social media for good. And a bunch of trolls in the comments section would put up these GIFs of flashing lights that some of the other patients who did have photosensitive epilepsy, then it caused them to have a seizure. And good for England. They made a law to prevent that and to prosecute the people that did that, those cyberbullies, those evil trolls, and put them in jail and give them fines and things like that. Zach's law that they have overseas, and now actually other countries, ours included, is looking into something like that. Because, again, social media can be used for good, social media can be used for bad. So trying to promote the good and reduce the bad is very important. And it is important to remember that it is not all bad. As much misinformation is out there, there's also a lot of good reputable sources. So medical journals, back in 2019, one of our best epilepsy journals, the Journal of Epilepsy and Behavior, that we as physicians use to spread our research about epilepsy, learn more about epilepsy in general and how to treat it and how to manage it, came out with their own Twitter account or X account or whatever we're calling it now. And the nice thing about it is that that account is free. Oftentimes these medical journals cost thousands of dollars in prescriptions, and a lot of people, myself included, cannot afford that. So, we're reliant to go to the library and check the journal out in order to read and get the cutting edge stuff. And now you're telling me that that journal is publishing its research on this free forum. And not only is it available to doctors and epileptologists, but patients can look at it too. Patients can read the actual research that's being done and that their doctors are using to make determinations about their condition. So it really promotes this good relationship between collaborators and researchers, helps relationship with doctors and patients. It's really kind of a nice system. And yes, I realize the bird is no longer the logo. I had to bring it back. It's just so cute. But anyway, Seizure, which is the European, like the big European journal for epilepsy, they have a Twitter page. Brain, which is another huge neurology, very reputable medical journal, they've got a Twitter page. Epilepsia, which is the International League Against Epilepsy's official medical journal, they've got a page. The Journal of Clinical Neurophysiology, Journal of Epilepsy and Behavior, like I mentioned, Epilepsy Disorders, Neurology. All of these really great medical journals have their own dedicated accounts. They publish their articles, they publish their research, they promote all the stuff that they're doing. Normally, these 7 journals, if you were to subscribe to them, it would probably cost $100,000, which is why hardly anyone does. But all of this is free, which is really, really nice. So hospitals have gotten in on the act, as have educational centers. It's a good way to spread information about epilepsy, do some education on the community level, build connections, and collaborate worldwide. Our own practice here, Case Western Reserve and University Hospital, we have a very robust epilepsy page that we publish a lot of research on and do discussions about epilepsy on. The clinic does the same thing. I believe Metro does, Akron. All of the local hospitals around here have these accounts where they can share. And again, other doctors can look at it, patients can look at it. It's all out there and it's all free. And even physicians on the physician level. I mentioned Dr. Danoon with his epilepsy videos. It's a great way to spread helpful information, reduce stigmas through education, and also, to have the doctors, patients be able to see the doctors as more a sense of the community, rather than, the separate, oh, I'm going to go to my doctor and then I'm not going to see them again until the next time I see them a couple of months from now. Our own practice, each of us have a Twitter account, and usually we put out different research or information that we're doing. Occasionally, I did post a picture of myself with the original lightsaber from The Empire Strikes Back, because I think my patients know, those who see me, I am a nerd, and doctors are people too. So sometimes it can be kind of fun to see that. Anyway, again, not a topic that I knew a whole lot about, but a lot that's out there. So kind of a fun thing. If anyone wants to read more on these, happy to share these references, or you can just Google epilepsy and social media. But happy to take any questions or comments.
Thank you so much, Dr.